Good afternoon, everyone, and welcome to the Joint Information Center briefing for Wednesday, May 19th, 2021. Next slide, please. Administrative notes. Next slide. Our unified command team. Next slide. The Joint Operations Center lines of effort and priorities. And next slide. The purpose of the Joint Information Center, or JIC. Next slide. And here's our agenda. Starting it off for us, current situation report is Eric Pessel. Eric, the floor is yours.
Hey, thank you, Dirk, and good afternoon, everybody. So a little bit of good news to be able to show today as we are reviewing our data and our continuing COVID-19 response. Our laboratory confirmed cases are now up to 12,144 all time, but as you can see on this slide, we are really coming down from a high back in mid-April, right around April 16th of the latest surge, and we are certainly falling back, which is great news. We're seeing less and less daily cases, and certainly the 7-day moving average you can see is trending in the right direction. Currently, we have 19 individuals that are hospitalized with COVID in our 2 local hospitals in Calhoun County, and we're at a total death count of 271 now. Next slide. So vaccination and where we're at in Calhoun County, as you can see on the graph, we're really flattening out. It's becoming a little more difficult as we're running these clinics to see people showing up for their first dose. I think there's many reasons why, and we're going to actually show you all some of the data that we do know of and where vaccine uptake has been happening well and where we still have some work to do. And then I think there's a speaker later on today that will also talk about educating the community specifically in some of these communities where uptake is not as strong. But we definitely are starting to plateau. We're starting to flatten out. It's really important that we try to reach that 70% goal of vaccination, and we still have a lot of work to do. Next slide. So recently, a couple of my staff and myself have been given access by the state of Michigan in partnership with the University of Michigan to look at census tract level data of uptake for Calhoun County. And so what you see on the screen is each one of those boxes, different shaped forms, is an actual census tract for Calhoun County. And then it's color coded by uptake of at least receiving 1 dose or more of vaccine. And so you can see the darker pink or the pink shading areas are less uptake. The very darkest pink, we don't have any, but the next level looks like 10 to 19% of the population in that census tract has received at least 1 dose. And then a better uptake is as you get darker green. I think as you can see on the map, maybe in census tract 15 looks like our best uptake in Calhoun County. So this, we at the health department have, much, we can go more granular than this. It's not something that we can obviously, make public because of information, health information of people. We can't get too granular, but we are able to at least show this to the public so they can kind of see as an oversight just where our vaccine trends are. And then my staff, along with our partners, can continue to work and address those areas that have very low uptake and see if we can get more education and more opportunities for those folks to be able to get vaccinated. Last slide, I think. Just an update on where we're at currently for at least the public health department scheduled clinics. Today, it's not on here, but today we're out at Harper Creek High School from 3 to 7. with the drive-through clinic today, tomorrow, from 3 to 6 at Calhoun Community College. And again, what we'll do there is we're going to kind of make that a permanent. Every third Thursday, we'll be there through July. You can see the dates are already there. We're there tomorrow. We'll be there again on June 10th. We'll be there again on July 1st. And then depending on how things are going at that point, we may be there again on July 22nd. This Saturday, we're at Homer High School for hopefully a great drive-through event there. You don't have to get out of your car, just pull up, roll your window down, roll your sleeve up. That's from 9 to 1 on Saturday at Homer High School. Hopefully the folks out in that area of the county that maybe haven't had a chance to get to one of our vaccine clinics will be able to make it to that one. Next Tuesday, Mingus Creek parking lot, what I like to say in front of the ABC warehouse, we're going to be doing a drive-through, and it's going to be more of a permanent location as well. Every third Tuesday starting next week. We're going to run through July, so it'll be May 25th next Tuesday, June 15th, July 6th. And then beginning June 1st, the health department will be offering vaccines at both of our locations in both Battle Creek and Albion by appointment. And we can either give J&J, Moderna, or Pfizer vaccine also at the health department. So I think, Dirk, that is it for me.
Okay, Eric Pessel, thank you very much for your report. We appreciate it. Coming up next on the agenda, Dr. Nettleton from our health department to discuss mask policy changes. Dr. Nettleton, the floor is yours, sir.
Good afternoon, everybody. I'll talk about that topic and also talk about another kind of hot topic. Some folks have questions about so-called breakthrough cases. So this past week was quite eventful. There was updated federal guidance from the CDC about masks. There was an update to the Michigan Department of Health and Human Services epidemic order. And there is also discussion about MIOSHA, or employer rules, administrative rules in the state of Michigan about masks. And it's kind of confusing, right? When you hear all this different information and, what steps should you take for yourself, for your family, and for your institution. So last Thursday, the Centers for Disease Control and Prevention announced that fully vaccinated individuals no longer need to wear a mask indoors or outdoors. And also don't need to physically distance as well. And so what was behind kind of that announcement? And again, just to be clear, fully vaccinated means 2 weeks after your final dose of the COVID-19 vaccine. That's what's considered to be fully vaccinated. So the scientific brief from the CDC is still officially pending, but the CDC director and science has communicated, and the scientific community can make assumptions that go behind this decision. So let's talk about what the vaccines do. We know that the clinical trials ask the questions: do these vaccines prevent severe disease, hospitalization, and death? And the answer to those questions is a profound yes. And in addition, even outside the clinical trials now, in vaccinations of hundreds of millions of people, we now have real world evidence that indeed these vaccines do all those three things out of those millions of people as well: reduce hospitalization, severe disease, and death. And furthermore, now we also have real world evidence that these vaccines are effective against some of the more common variants. For example, the B.1.1.7 variant. That also gave confidence to also modify the recommendations for those who are fully vaccinated. And furthermore, we now have real world evidence emerging that these vaccines indeed reduce transmission or reduce the spread of the virus that causes COVID-19. Our vast experience with vaccines from scientists, public health professionals, researchers, that's why we do vaccines. Now we have that real world evidence that supports that even outside the clinical trials of the vaccine. So all of those decisions, all of that evidence, the scientific evidence, in addition to the idea of promoting or incentivizing the reason of why should you get vaccinated, I think informed the CDC's decision to make this announcement. After that announcement, the Michigan Department of Health and Human Services updated its epidemic order. And so instead of guidance, this is an order from the state of Michigan that if you are fully vaccinated, you are no longer required to wear a mask indoors. And while outdoors, you are not required to wear a mask in general either, overall. So that was an update to the epidemic order itself. So the question is, well, how that has really been, I think, in the community and overall. Oh, before I go there first, the last thing is that MIOSHA, the regulatory body for employers in the state of Michigan, is aligning with the CDC recommendations and the MDHHS epidemic order. But we're kind of still in between that zone of transition of those administrative rules. So right now that transition is occurring to make sure that the MIOSHA guidelines that or really rules, I should say, rules are planning to be updated as well. So behind all of this is the question is, well, how do you know whether your neighbor is vaccinated or not? And that's really kind of behind, I think, a lot of the challenges that it presents to individuals, families, and institutions. You know, in the epidemic order, there are three things that the order allows for in terms of meeting the epidemic order's requirements. So one, you can post a sign that says of unvaccinated individuals are required to wear a mask indoors. Two, you can ask people whether they've been vaccinated. Three, you can have a policy within an institution to wear masks, or the last option is another policy or procedure that ensures that you're following the epidemic order. So that's just a clarification about that. But I think, you know, overall, when we think about this issue of masking, for me personally, this is also a question of citizenship. And it's really at that point of that responsibility of, if you are not fully vaccinated, again, 2 weeks after your final dose, to wear a mask while you're indoors. So the question often comes up, well, what about schools? Well, after the CDC announcement on Thursday and the epidemic order that came out Friday morning, Saturday morning with its in effect, the CDC made another announcement and recommendation that all K through 12 schools continue their existing policies and procedures for the 2020-21 school year. So in other words, to continue universal masking in those school environments. And so that came out on Saturday. And overall, besides the science that's behind masking, you know, I think what often comes up too is the social or cultural or behavioral aspects of masking. You know, we think about a role model, for example, within a school environment. And if that individual takes off their mask, and maybe there are younger students around that person, and the person's in a higher grade, you know, that may create the sense of, well, what's the right thing to do in this case, when particularly children below the age of 15 haven't had the opportunity to be fully vaccinated. And so those policies and procedures and universal masking, I think, are what institutions are looking at to ensure that they're able to follow the epidemic order and really to follow kind of some basic citizenship at a time we are in epidemic status. And so the last question I see to be addressed is, you know, should families with young children take off their masks in public? And so, as we know, the epidemic order is specifically for indoors for unvaccinated individuals as being required to be wearing that mask. And that's the order and also the advice that I would recommend. You know, children under the age of 15 are not fully vaccinated, and then therefore should be wearing a mask if they are 2 years or older and do not have another exception. Those are the updates I have on mask policy changes. I also wanted to address a common question that comes up with something that is known as breakthrough cases. You may have heard in the news or a news article about someone who has been fully vaccinated, but then ended up getting COVID-19. And it brings up all these questions of, well, is the vaccine effective therefore or not? So let's talk about that a little bit. So one it is expected that some people do indeed get COVID-19 after they are fully vaccinated. But most likely, these individuals are not hospitalized, do not have severe disease, and they haven't died. That's the point of doing vaccination. We want to prevent severe disease and we want to prevent hospitalization. And when a person does get COVID-19, besides not being very sick, they're probably less likely to transmit the disease as well because they're not as sick overall. So you may hear headlines about hundreds of breakthrough cases. I've seen that headline too. The thing to also remember is hundreds out of what number? And the answer to that is millions. If you have hundreds of cases, but the bottom number is out of millions, that's a very, very small percentage of people who have a breakthrough case. So that's the other thing to ask when you see those questions happen. The other thing is, well, what's going on in Calhoun County? We are indeed looking at our data as well as partnering with the state health department. And again, it corresponds to what we see on a national level, that breakthrough cases are very, very rare, less than 1% of our cases overall. So this supports the fact that these vaccines are indeed highly effective, and they also prevent those severe outcomes of disease and death. So I just wanted, and the closing point is that we as public health professionals indeed investigate so-called breakthrough cases. I want to know, as a physician and a public health professional, if someone indeed is hospitalized or died of COVID-19. We do those type of investigations as basic public health surveillance. We want to know if there is somehow a new a variant that's emerged in a different part of the world on a national, state, or local level. But we have not seen that yet here in Michigan or in Calhoun County. These vaccines remain highly effective. So those are my updates.
Okay. Dr. Nettleton, thank you for the information and the education today. We appreciate it. Up next is the local government's update with Assistant City Manager Battle Creek, Ted Deering. Ted, take it away.
Yeah, thank you, Dirk, very much. I also would like to thank Dr. Nettleton for lots of excellent information about some of the rationale and thinking behind our mask policy changes. I know some of us are uncertain about exactly what that means for our organizations, but one thing that we are not at all uncertain about is that the federal law still requires that you wear a mask when using public transportation. So if you're riding a city bus, if you're using our paratransit service, if you're using our teletransit service, or even if you're riding on BC Go countywide, you're still required to wear a mask. Certainly our employees will be wearing a mask, and all customers need to wear a mask as well. Obviously, we have been working closely with the county throughout this pandemic process, coordinating our activities and our operations. Those dialogues continue as we try to sort through what these new public orders mean, what this new guidance means. Has been mentioned a couple times, I think, on this conversation so far today, that MIOSHA rules have not changed. We're waiting for updated orders, and as a result, for both entities, operations are status quo. We're still following the workforce rules that are in place, which have, of course, mask requirements, screening requirements, social distancing requirements, et cetera, et cetera. So we'll be interpreting changes over the next couple of months, and I do expect there will be impact on our operations at the city for sure over the next few months, but right now things are status quo. Kelly Scott at the county has done a great job throughout this process of keeping us updated on what's going on with the courts. As you can see from the slide here, courts will continue to require masks, again, regardless of guidance, similar to what we see with public transit. And we have been evaluating, last year we unfortunately had to close the flash flood water park for the season. That's a difficult decision to make. We know people are anxious to get out and recreate this year. I do think as it sits today, we will likely be able to open up our outdoor pool over the Memorial Day weekend at likely 50% capacity. So, the schedule for the pool typically is some opening weekends until school gets out, and then we go full bore for the rest of the summer. Right now, health orders would indicate we need to operate with some capacity limits, but I do think at this point we should be able to open the pool. And that is all I have for today. Thank you.
Okay, Ted Deering, thank you very much for your report. We certainly appreciate it. Up next on our agenda is Angela Stewart, and she's here to discuss vaccine education workforce. Angela, the floor is yours.
All right, thank you, Dirk. So I'm just going to share a little bit about our campaign. The Population Health Alliance of Calhoun County provided some funding from community partners to really work on educating the community around COVID-19 vaccine, to address any fears and misinformation around the vaccine. And our focus area is around communities of color as well as the age group of 18 to 35, because we're really focused on populations that are a little less likely to take the vaccine. Next slide. And so due to this work, we've put together a work group, and the purpose of this work group is to really collaborate on the messaging and also resources relating to disseminating the information. So they help us with providing some strategies and some best practices, and they also help with some of this outreach. So the objectives of this group is to really establish membership across Calhoun County, making sure that we're hitting all different pockets of the community, as well as to be formed with trust agents who already have some trust in those populations that we're trying to serve. And then they help with just monitoring how we're disseminating the information, identifying where we might need to be doing a little bit more, and help us to identify where some of those problem areas are, where there's areas that we might need to address some issues. So I love the Census Tract data, and we can look at that to see where we need to do a little bit more work. And then we provide updates such as what we're doing right now. So this group reports to many different groups, and just to kind of share what we've worked on. Next slide. And so some of our outreach that we've done so far, and a lot of this was really around a clinic that was held on March 26th for some of the different populations we're trying to serve. And so we've done some different flyers. We did some robocalls out from a couple of our partners with Carewell Services and Community Action. We also did some door-to-door canvassing. We worked with the HR group and provided some information to them through BCU. And then we've even purchased phone numbers and called people within certain census tracts. And we've worked with VOCES and the Burma Center as well to do some outreach efforts. And I'm going to share a little bit about the door-to-door canvassing and what we heard from that. But that was really a pretty intense piece that we did, going literally door-to-door in neighborhoods and talking with folks about the vaccine. So next slide. What we learned from some of those canvassing efforts and what we heard from our volunteers that went out and did that work were a few different things about what they were hearing from people out in the community. For one, they were still seeing a lack of trust around the vaccine, not feeling like it's safe. They might not feel like it was researched enough. They had questions about were fetal cells used in that. They also heard that the CDC said this was an experiment. And so there was a lot of misinformation that was kind of out there, as well as some things that we could help to really answer and talk with folks about. We also saw that, and this was just coming from our volunteers, that they felt like the men 35 to 50, they were getting more no's from around signing up for a vaccine versus some of our other populations. And then we also did see a need for some transportation or in the home type of vaccination. So we were able to provide some transportation to the clinic that they were scheduled for. But then from this population, even at the clinic, we saw a little more hesitancy with even getting the shot. Folks were still a little bit leery of it, wanted to talk to one of the nurses, but we worked through that, actually working with the health department and answering some of their questions. And I don't believe we had anyone that walked away that day, but there was a little bit of hesitancy around still getting the vaccine. Next slide. So we wanted to dive in a little bit deeper with some of our information as well. So we partnered with Arise Corps food distribution sites. There were two sites, one in the Post Franklin neighborhood and then one in the Washington Heights neighborhood. And we just asked them for a little bit more information around getting the vaccine, how they felt about it. And you'll see there's some demographic data. we loved this piece to be able to survey here because we were hitting more of a population of color with our questions, but also what was promising was the proportion of folks that had been vaccinated. So you'll see there that we have 51%, which is promising that some of our equitable practices on how we're trying to distribute the vaccine might be working, but we're still waiting for that disaggregated data that gives us exact numbers around, are we seeing the same type of ratio of people that are being vaccinated, not only in the white population, but also in populations of color. So this is just really initial information that we're getting through the survey, but it's at least promising that some of our tactics are working. We did see a higher rate of reports of not willing to get the vaccine from the Black or African American population within women 25 to 64. So that's going to be an area that we really start to kind of hone in on and see how we might be able to get information out to that population, as well as have some discussions about what their concerns might be. And then also, we didn't see any real significant difference between the other pieces when it comes to gender, race, or age. And we also didn't see a significant difference between the post-Franklin neighborhood or the Washington Heights. We were kind of expecting maybe a little bit higher rate of folks getting the vaccine in the Washington Heights area, since we've held some micro clinics there, but we didn't see a big difference between those two neighborhoods. So we'll be looking further into what we're getting. We have some plans with the RISE Corps to do some follow-up pieces, but at least the first initial data was promising that some of this work is providing an impact. Next slide. One thing that we've also done is we've launched our Facebook page under PHA Calhoun, so folks can go to that. We have a lot of information around the vaccine there. We also pull some things from the health department as well, but this has some information that is relatable. You might see some local faces on there, but all of this information is able to be shared. And so if you're on your social media and would like to help us with getting the word out, you can definitely go there and share some of that information and just kind of the education pieces. Next slide. So some of our next steps, and we actually planned and we held last night our first ambassador trainings, working with the health department and Dr. Nettleton that you heard just a minute ago. And we wanted to address questions that some of our ambassadors had. And when we talk about ambassadors, we have some very formal ambassadors that are going door to door and helping us with some of this outreach. And they're really leading some of these efforts. And then we have some folks that say, I just want to be involved a little bit. I want to get some information out. I want to be a little more educated about the vaccine. And I think any of us are kind of having some of those conversations around, you say hello, and the next statement is, what do you think about COVID, or what do you think about the vaccine? You start those conversations. So this just gave folks an opportunity to feel comfortable talking with other people about the vaccine. And we had about 50 participants between two different sessions yesterday that were trained on the vaccine and also could ask their own questions of Dr. Nettleton with that. So what we're going to do from there is we're going to continue to build that network. We've hosted that training, but we've recorded it. So if anyone else would like to be an ambassador, we're also sharing that with any of them. We gave those folks some t-shirts that they can wear out in the community. And then we've also provided them with other opportunities to share the message. So we'll have additional opportunities to go door to door, to have yard signs in their yards, to just do outreach within their different networks. And so we're continuing to build that. If anyone is interested, they can contact me. Also, we are looking to learn some more information about community concerns. There's a survey that's happening in Albion through Albion College that's due to be done in June, and we hope to gain some information about how folks in Albion are feeling. And then the other piece that we're doing is a survey with Battle Creek Public Schools to learn a little bit more about how families are feeling, not only about the vaccine, but also being back in school and operating within that school space with one another. So that survey we hope to have concluded by the end of the school year, but that will be launching here very quickly. So thank you so much for having me today. We look forward to partnering and continuing a lot of our work moving forward, but you should be seeing us in a lot of different aspects of the community. So thank you.
Angela Stewart, thank you very much for that comprehensive report. We certainly appreciate it. And next is comments from our elected officials. Our last slide today. We're going to kick it off with Senator Bizon.
Hi, everyone. It's Karen Todd in Senator Bizon's office. I am just wanted to give you a couple of things today. The Michigan Senate, they voted, I believe it was at the end of last week, to pass a fiscal year 2022 budget plan. It's a 17 bill budget. The Senate GOP's fiscal 2022 budget highlights include record funding for Michigan schools, $20 million increase to assist students with dealing with mental health challenges, $77 million to reduce the cost of childcare, pay increase for frontline direct care workers in nursing homes and hospitals, $38 million to help nursing homes recover from the impact of COVID-19. There are several more, and I do have the details of the budget if anyone is interested in that. And I will put Senator Bizon's email address in the chat, and you're welcome to contact his office and we can give you detailed information on that. And then the other piece of information I had is the governor and her administration are seeking to make permanent restrictive rules with the Michigan Occupational Safety and Health Administration Emergency Workplace Safety Rules. The rules, which were adopted temporarily during the pandemic, are set to expire on October 14th. MIOSHA recently requested that the rules be made permanent once the temporary rules expire. And as part of that rulemaking process, all proposed rules are subject to a public comment period and a public hearing. That public comment period is open until May 26th. Senator Bizon is encouraging anyone who would like to comment on those MIOSHA rules to please get your emails into him, your letters. Feel free to call the office and we can transcribe your comments and we can pass those along to the administration. And again, I will leave my Senator Bizon's contact information in the chat. And I think that's all I have. Thank you.
Okay, Karen, thanks for sharing that information. We appreciate it. Up next, Representative Hatzma. And I don't think Jim is in attendance today, but I'll leave it open one more time. Okay, hearing nothing from Jim, we'll move on to Representative Hall. And moving on to county elected officials. Moving on to tribal elected officials. Karen, thanks for posting that. We appreciate it. And next, city elected officials. Township elected officials. And finally, village elected officials. Okay, hearing none. Move on to the next slide, please. Our best information sources are listed there. And final slide. Contact us. Our 3 PIOs do an excellent job. There's their information if you want to talk to them. Send a message. And that concludes this JIC for today, this Wednesday. We'll see you in 2 weeks. Stay safe and have a great day. Thanks.